breast oncologist, and she's going to talk about the advances in the management of breast cancer.
Okay, good morning. Thank you, Thor, so much for that introduction. Thank you for the opportunity to speak on these updates in breast cancer from the past year. And these are my disclosures. All dollars received go back to Mayo Clinic in support of our breast cancer research program. And I selected abstracts and manuscripts from the past year that really are those that have the most impact on our practice and clinical practice today. And so you'll see that the ones that are selected are predominantly adjuvant trials for stage 1 to 3 breast cancer. I did select a few abstracts simply to highlight for stage 4 disease. I would say in the last year there hasn't been much that has been significant in terms of changes to our clinical practice, but there are a few just to briefly highlight here. The first is the Mona Lisa 3 trial. This was an evaluation of fulvestrant with ribociclib, the CDK4/6 inhibitor, or placebo in postmenopausal women with advanced ER-positive, HER2-negative breast cancer. These patients were treatment naive or had received no more than 1 prior line of endocrine therapy in the metastatic setting. So the results demonstrated that the addition of ribociclib to fulvestrant resulted in a statistically significant 8-month improvement in progression-free survival when compared with placebo. And notably, in patients with measurable disease, there are very significant objective response rates, so complete or partial responses here at 41%. The clinical benefit rate, which also incorporates the 6-month stable disease rate along with objective responses, was just shy of 70% here. So these are very impressive numbers. And again, these data are consistent with other trials with the other CDK4/6 inhibitors, abemaciclib and palbociclib as well. So really, these drugs have become, for the majority of patients, the standard of care for first-line therapy for ER-positive, HER2-negative metastatic breast cancer. The Sandpiper trial was a phase 3 study of fulvestrant alone or in combination with the alpha-selective PI3 kinase inhibitor tisalicib. And this was evaluated in postmenopausal women with more advanced metastatic disease that was AI resistant. And importantly, these tumors of the patients had to harbor a PIK3CA mutation in order to be eligible for participation. So this study did demonstrate a statistically significant 2-month absolute benefit in progression-free survival for the addition of tisalicib as compared with the placebo. However, there were markedly more grade 3 or higher adverse events and significant toxicities, as well as higher rates of treatment discontinuation with the combination therapy. And I think that